Dear subscribers, happy to inform you that I'm launching an online teaching session on bedside clinical medicine. Now, basically, in these online sessions, you will be learning about the basics of clinical history and how to understand on the basic components of how to arrive at a diagnosis based on what the patient tells. Primarily, this will be for the MBBS final years to understand the concepts which govern the provisional diagnosis based on clinical history, and you will be taught on the basic components in clinical examination, mainly focusing the four traditional systems, which are the cardiovascular, respiratory, abdomen and nervous system. A detailed guidance on how these clinical methods are done at the bedside, and especially its advantages and disadvantages, because some are historical methods which may not have relevance in the current modern era, but there are certain science which still holds good despite the advancement in technology. And additionally, you will be taught on the rationality behind the diagnostic investigation requested to arrive at the proper diagnosis based on what you suspect based on history and clinical examination. The methods adopted will be a weekly online session lasting about 90 minutes every week for a period of 6 months, so it will be 24 weeks. And between the classes, you will be having an app based sharing of many clinical materials for reading, for viewing, and also app based quiz on clinical concepts, revising what you have already learned in the previous class and what you are going to learn in the next class. And we'll be also having an online discussion forums where the entire group of students will be benefited. So interested students can email your details, which are your name, your year of MBBS, the college name, mobile number and email. And I fixed a subscription of around 1000 for a period of 6 months, but I'm willing to waive it in case the student is in financial need. And this cost is primarily targeted on the time spent on preparing for the class and the class itself, so that I am not at a loss because of this session. And the session is likely to start in the first week of April 22. So those who wish can send their details and their eagerness to join. I am planning to include 100 students to begin with. Primarily, priority will be given to final year MBBS students and maybe first year MD General Medicine postgraduates. Thank you.